and today I'm going to talk about my volunteering experience with ProMedica Health, also called Heartland Hospice. So, ProMedica Health's mission statement is to improve the health and well-being of those whom we serve, including those who are the most vulnerable and least fortunate among us. ProMedica is over many different areas of healthcare, but I pull more from the hospice side when it comes to ProMedica. So a little bit about ProMedica is it is a not-for-profit organization. They care for people nationwide, 26 states across the entire U.S. They're accredited by the ACHC, which is the Accreditation Commission for Healthcare, which raises their standards for caring for patients, especially hospice patients. They do not require a DNR, also called a Do Not Resuscitate order, in order to care for patients, and they also do not require a living will to begin providing hospice care, which makes it very easy for more patients to be under their care. They were founded in 1986, and they employ over 56,000 people in their entire system. The importance of volunteering for hospice. So it is actually mandated by law, by Medicare Law 418.78, that hospice care has to have at least 5% of their total care being by volunteers. This is because way back when hospice was started, it was started by volunteering 100%. So all hospice organizations in the U.S. are mandated that they have to have volunteers to kind of keep to their roots of hospice being not-for-profit necessarily. So services offered by ProMedica specifically is they do referrals and admissions 24/7. They are certified hospice and palliative care nurses specifically. They have on-site referral coordination, and they offer comforting treatments to hospice patients such as TPN, PCA pumps, and tracheostomy care. They provide tuck-in calls before weekends and holidays, which I'll talk about a little bit later. They have veteran-to-veteran programs, and they do up to 13 months in bereavement services for the family members after a patient has passed. They have memorial services, especially for veterans, and they hold vigil services. So my impact, so meaning what I have done so far volunteering with ProMedica, is I have helped with admissions by doing admission packets, which I have pictures of later in the presentation. Also, I have been a listening ear to some families as they've been going through the start of this process when they come into the office. And I've also done talk-in calls. So talk-in calls is pretty much the staff member gave me a list of patients, their caregivers, and a phone number, and I would call them, say, hello, my name is Mackenzie. I am calling from ProMedica Care just to see if you need any medication refills, any resources, any kind of like briefs, and you need a new walker, something like that. Anything you need that'll get you through the weekend. And they would say, yep, I need some more morphine. If you could let my nurse know or get that refilled for me so my wife can go pick it up tomorrow. So that's what the talk-in calls were. That was very nice because I actually got to talk to the patient some of the time, and if not, their caregiver. So I could kind of feel the stress or, okay, maybe they're doing okay right now, and I could relate that to the nurse. So how I can help others. Going forward, this has helped me not only in my nursing role as an oncology nurse, also doing inpatient hospice, but as well as going forward as volunteering. I have learned how so much better to comfort those that are dying and those family members of dying patients with therapeutic communication and active listening. I have learned how I can help better transition my new hospice patients go into the outpatient setting by preparing them for what they may see, what they may need, how this whole process is going to go once they're discharged from the hospital, how to better assist grieving families, and understand the true meaning of hospice and palliative care down to it can be absolutely no care and all payment, or maybe they still do take their Synthroid and maybe they still want tracheostomy care and all the things. So hospice's impact on me. So personally, this has helped me learn and grow, especially with my empathy, because I had never been exposed to hospice care before becoming a nurse. So I have really learned to love how big of an impact this made on me and how I can care for this type of patient, since this is not really something you learn about when you go through your RN program. So I've really grown from that. I have learned more office duties, which actually has helped me as well organize my paperwork as a nurse. As you can see in the background of this picture, that is the laundry list of paperwork that needs to go into an admission packet so that the nurse can go over the 4-hour-long discharge that they have to do when they start with ProMedica. And the other picture is my volunteer training manual, which is a very thick binder that took very long hours to go through with my volunteer coordinator and a couple other volunteers, just to learn the whole process and all the things that are involved. Because when I did my orientation, it was pretty much like being hired on like an employee. I had to go through all the safety trainings, how to talk to people, and all the different services that I can get involved in. So we're talking about nursing duties with ProMedica specifically. They do admissions, patient monitoring, patient status reporting, meaning that every day at the end of the day, they have a conference call with different members of the care team, like case managers, staff members, volunteer coordinators, saying, okay, this patient is closer to dying, they don't want volunteer services at this time, or this patient has an appointment on Monday, we need to get some transportation for them, kind of things like that. They collaborate with other members of the care team, they do caregiver relief, meaning if the wife who is their sole caregiver needs to go to one of her health appointments, then they can coordinate with the volunteer coordinator or the case manager and come and visit the patient at a particular time so somebody's home with them. They do medication management by ensuring that medication coverage is appropriate and they have enough of what they need, and they do postmortem care. So nurses at ProMedica engage in evidence-based practice, scholarly inquiry, and nursing research. I haven't seen any specific details, but I also haven't gotten to see many nurses since they are on the road all the time. But I am very interested to continue to watch how they implement their evidence-based practice into this hospice type setting. Collaborating for safe quality care and exceptional patient outcomes. I think this really ties more into how effective they are with communication with all these conference calls and these meetings, as well as enlisting nurse practitioners and PAs and doctors to come and actually see the patients or conference call with the patient while they're with them. They foster environments that support optimal patient, physician, and staff satisfaction by doing continual feedback and actually having volunteers such as myself do talk-in calls to make sure they have everything that the patient needs. And they are stewards for resources and advocates for safe, compassionate, and healing environments. That is huge, and that is why they have so many case managers on to ensure that the patient is safe, and if something wasn't safe, that something can be done about that. So nurses are awarded through ProMedica Health. They do the DAISY Awards, which is for extraordinary nurses, which is patient and family nominated, and they also do Rose Awards, which is very similar. So that just says that the nurse that is awarded raised the standards of excellence by doing certain things. This person was recognized the second quarter of this year by their DAISY Award. So in conclusion, I have had an amazing experience with ProMedica Health with their hospice care. There is a great need for volunteers, not only mandated by law, but having over 130 patients in the Mount Pleasant area alone just proves that there is a huge need for hospice volunteers. It has made an impact on me, and my personal impact, I feel, has made it easier for the nurses and the staff members to get their jobs done by doing the admission binders and doing the tuck-in calls, by just saving them time and allowing them to focus on the more important task. The nursing impact on patients is very important, and it is important for me to understand as an inpatient nurse so that I can transition them to be outpatient. And the impact that ProMedica has on nursing is very important to make their nurses happy and healthy and help the nurses grow to make healthcare grow by itself. This is my references. Have a nice day.